Is it recording already?
Yes.
Okay. Hi, welcome and thank you for joining us today for the meeting of the New York City Health and Hospital Equity, Diversity and Inclusion Committee. Today's meeting is officially called to order. Next on the agenda, I would like to propose a motion to adopt the minutes of the Equal Employment Opportunity Committee meeting held on April 12, 2021. I will ask each member for their vote. Jose Pagan?
Yes.
Dr. Katz?
Yes.
Sally?
Yes.
Okay. I think Frida and Michelle and Dr. Morse is not here. Is that correct? Yet?
No, they're not here yet.
Okay, thank you. So the motion is passed. Now we will have Dr. Cineas and Dr. Davis will provide an update on the Equity and Access Council.
Great. Good morning, everyone. I'm just going to provide you a very brief update on our activities on the Equity and Access Council. Next slide, please. So we've been spending the last couple of months working on really developing our system level metrics, and we'll share a brief preview of what those metrics look like. And we've had some kickoff meetings already for our equity work groups. Some of those meetings have already occurred and others are in progress of being scheduled. And just as a reminder, our 4 work groups are workforce diversity, inclusion, and equity of care and evaluation and monitoring. So each of those work groups will be working on developing different work plans along with their timelines, and we will be establishing success metrics for each of the work groups. Next slide, please. Just an update on our proposed equity metrics. So we are still having discussions on the metrics surrounding workforce diversity and inclusion. This is discussions including HR, as well as the Office of Diversity, as well as the council. And we're working together on figuring out the optimal metrics that can be seen in terms of quarterly improvement. So that metric is still to be determined. For equity of care, we are working on looking at the percent of system chronic disease dashboards that have integrated race, ethnicity, and language values. Currently, there are 5 chronic disease dashboards. There are dashboards for diabetes, hypertension, smoking, and adolescent depression, as well as adult depression. None of those dashboards have race, ethnicity, and language currently included, and our goal is to have all 5 of those dashboards with race, ethnicity, and language so that you'd be able to stratify each of those chronic diseases according to those variables to see whether or not there are actual differences. And for the MWBE metric, that is also under discussion with the SVPs of business ops as well as facilities development. So more to come on the metrics that are to be determined. And that's it for our update from Equity and Access.
Thank you, Dr. Davis. I would like to ask the member of the board if they have any questions. Jose?
No questions, just to commend you on all the work that has been going on. I know this is just the report and things happen in the background. So thank you so much for thinking about equity and access issues in our system.
Thank you, Jose. Dr. Katz?
No questions, thank you.
Thank you. Frida? Frida.
Hi, thank you.
Hi, how are you? Yes, okay.
This is, I know it's a lot of work. It's very important, and looking forward to hearing more as you develop the metrics and goals.
Thank you, Frida. Sally? Sally, I think you are muted.
Questions, thank you.
Thank you. I also don't have any questions. Thank you for your report. I think, as has been said by both Jose and Frida, this is incredible work. I think this is something that definitely will help us to understand more about our care, our communities, and what we can do to continue to improve and provide them the best services. So thank you, Dr. Davis, for this report.
You're welcome. Thank you.
Now we have an update from Blanche Greenfield, Deputy Counsel and Chief Employment Counsel. Blanche?
Good morning, and it's good to be back and see you all. So thank you for giving me the opportunity to report out on the important work of the Office of EEO. So the Office of EEO is responsible for ensuring compliance with our EEO policy, which is set forth in OP 2032, by providing an avenue for our staff members to file internal complaints of discrimination. We also handle reasonable accommodation requests by staff members. The Office of EEO provides system-wide training, and they also respond to external civil rights complaints. Next slide, please. Just some context for the slides that are coming up. A reasonable accommodation is a modification for any job which will allow a disabled employee to perform the essential functions of their position. Internal complaints are those filed by staff internally for the Office of EEO to review. And external complaints are those either filed with the City Commission of Human Rights, the State Division of Human Rights, or the Federal Equal Employment Opportunity Commission. And the office is responsible for responding to all of those complaints and for handling the reasonable accommodations. Next slide, please. As you can see from this slide, every facility is covered by an EEO officer. An EEO officer may have responsibility for more than one facility, but there is no workplace that is not covered by an EEO officer. Next slide, please. As you can see, we had a very busy year in 2020. The number of reasonable accommodations requests went up by approximately 1,000 from previous years due to the challenges faced by many employees during COVID. So that kept the office very, very busy during that period of time. Next slide, please. As you can see from the next slide, notwithstanding the challenges of 2020 across the system, the Office of EEO and departments worked very, very hard to ensure that we accommodated as much as possible staff members who needed a change in assignment, some other modification, or needed leave as a reasonable accommodation. So while we had a large number of requests, our commitment to keeping people working and keeping people employed was always the goal of the office and the system. So we have a very high number of granting of reasonable accommodations during 2020. Next slide, please. The internal complaints filed during 2020 went down slightly, but the number is always, you can see, is fairly consistent over time. People do use the Office of EEO as we move on in the presentation, and you'll see external numbers. Our internal complaint numbers are always higher, at least they have been historically, than our external complaints, because our staff members really do avail themselves of the office and have faith in the office to conduct a fair investigation. Next slide, please. The next slide reflects the findings of the Office of EEO with respect to internal complaints. We could either find reasonable cause, no reasonable cause, or conduct that's inconsistent with the spirit of the policy. I believe in previous years we explained that the OP was revised to include that third category of finding because we felt that reasonable cause and no reasonable cause were not enough. That were not adequate to cover the spectrum of conduct that comes before the Office of EEO. And the office is not trying to determine whether or not somebody violated the law. They're trying to determine whether or not there's conduct inconsistent with the spirit of inclusion, diversity, and respect that is the cornerstone of the institution. So we added to OP 2032 this third category of inconsistent with, in order to capture some other behaviors that need to be addressed. Next slide, please. In this slide, you get to see the types of complaints that are filed. And I ask you to keep this in mind as we go to external complaints, because the largest number of complaints that we have internally are sexual harassment, race, and retaliation. The sexual harassment numbers complaints went up in 2019 because, as you will recall, that is the year the mayor passed the Stop Sexual Harassment law, which also expanded the limitations period for bringing a complaint from 1 year to 3 years. So conduct that otherwise would have not been timely brought to the Office of EEO was now timely. So we had a spike in complaints in 2019, and the number has stayed the same in 2020. The second category is race, retaliation, national origin, and disability. Next slide, please. Our externals went down dramatically in 2020, but we have already seen an increase for 2021, which obviously we'll be reporting on next year. And I can tell you that the increase in complaints now looks to the fact that anybody who may have been denied a reasonable accommodation during 2020 or didn't get an accommodation that they were satisfied with has been filing externally. But we'll report on that next year, but that is what we're seeing right now. Next slide. So as opposed to the nature of the complaints that we have internally, where sexual harassment is the largest number of complaints, you will see here that external complaints, the largest number of complaints is disability discrimination. So, excuse me?
Oh, nothing. I said,
Oh, yes. So what this is when we review disability discrimination complaints, before there's any denial of a disability, or excuse me, a reasonable accommodation request for disability, that is reviewed by our office, the Office of Legal Affairs, because we understand that if somebody is not granted a reasonable accommodation, they then may seek to complain externally. And in fact, the numbers do show that. It also shows you that though we have 47 of sexual harassment complaints internally, individuals did not file externally after receiving the results of our investigation, which I would like to think is because they were satisfied that the investigation that was conducted was fair and reasonable, and they did not see the need to file externally. But it is very, very interesting that the external complaint basis is very different than the internal complaint basis. Next slide, please. As you can see also from this chart, the number of reasonable cause complaints findings by the external agencies went up in 2019, but we do receive a large number of no probable cause determinations. We did not receive any probable cause determination. In 2020, there are still a large number of complaints that are pending. And one of the things I would just draw your attention to, the total number administratively closed. In the past, the City Commission on Human Rights had issued no probable cause determinations. What we have found recently over the past, I think, a little bit more than a year, is that the City Commission is no longer issuing no probable cause determinations. Rather, they're administratively closing the complaints so that the litigant is not foreclosed from bringing other litigation. So I expect that we will see over time that the number of complaints that are administratively closed will increase, and therefore the number of no probable cause findings will decrease. But that remains to be seen over time. Just back to reasonable accommodations, just to give you a little historical perspective of the way the reasonable accommodation requests have gone up across time, across the system, from a low of 1,022 in 2016 to the high of 2,728 last year. But obviously the number seems to hover in normal times, whatever that means, between 1,600 and 1,700. So it is, there are staff availing themselves of the office and these requests. The external complaints of sexual harassment, as you can see here, also going back over time, is that we have not received a probable cause determination in matters relating to sexual harassment. And for our updates, we implemented a gateway to log our complaints and information in 2019. We're updating that now to include additional metrics so we can drill down a little bit more by facility to look to see what's happening at each facility and how different they are. We did revise the EEO policy in August 2020 to reflect the changes in law, and also to provide EEO officers who may have a complaint about another EEO officer or somebody from the Office of Legal Affairs to file a complaint directly with corporate compliance so that they feel that they have an avenue of redress, an alternative avenue of redress. And we are still recruiting to fill 2 more EEO positions so that we have our full complement of EEO officers in order to continue to handle the work of the office. Thank you. Do you have any questions?
Thank you, Blanche. Let me poll the members of the committee. Jose, any comments or questions?
No questions. Thank you, Blanche.
Thank you, Jose. Dr. Katz?
No questions, thank you.
Thank you. Frida?
I just have a question just for my understanding, Blanche. The external complaints, are those generally coming after an internal complaint has been filed and resolved, and then the complainant will go to an external source, or are they not really connected in that way?
Both. Sometimes we'll have somebody who filed internally and then goes externally. I can't even say it's half, but some people do initially just file externally. But once you file internally, you're not foreclosed from filing externally. So you can file internally if you're not satisfied with the outcome of the investigation, or you have any additional concerns, you may file externally, and then the office will respond to the external complaint. Some people, especially those who have counsel, may initially just file externally.
I see. And in terms of sort of the pending, I noticed there's still, I know it must take a lot of time. You have 2,700 requests this year for example, the reasonable accommodation. But what is your general expected timeline for resolving, say, a reasonable accommodation request or an internal complaint? Does it just depend upon the circumstance, or is there?
Well, yes. Well, it's the expectation is 90 days for sexual harassment complaints. Depending here at this time, the answer is a little bit different. So I'm just going to take you back in time. We lost approximately 3 staff members during 2020. We had some temporary staff members that left, and it appears that the gateway where we logged the closure the information was not actually logged in. So the pending doesn't necessarily mean that it wasn't addressed. It means it hasn't been closed in the gateway. And we are currently working on that to review it and actually close out those cases that have been responded to and addressed. But as long as the gateway reflects it's open, we have to report it to you as pending.
I see. And that's for both reasonable accommodations as well as the internal complaint.
Yes.
Okay.
Yes.
Thank you, Fanny. That's it. And thank you, Blanche.
Thank you, Frida. Sally?
Yes. I hope I'm on.
Yes.
Oh, good. Frida and I are of like mind on the pending. But before that, I'm new to the committee, and I'm so impressed that we have EEO represented at each one of the facilities, because it really does demonstrate our commitment. On the pending, just if it would be possible, not obviously right now, but to pull out those that are really pending and those that are just kind of administratively pending as you process them, that would be helpful.
Yes, I hope to update you with that information. We're trying to go through it right now. We have an
Okay.
additional staff member that joined us who will be helping us go through the gateway and make sure that the matters are properly coded and addressed and closed.
Yes, and the 2020 internal complaints, not internal complaints, reasonable accommodations, were those
Yeah.
largely related to COVID?
Yes.
Yes,
Individual staff members who either did not want to work in COVID hotspots, who wanted to telecommute, who needed a change in assignment. As you'll recall, in the beginning of the pandemic, there was the need to keep staff working at the facilities. So we try to find them maybe alternative assignments in order to keep the facilities adequately staffed. And then, of course, there were large numbers of requests to telecommute or for leave.
Okay, thank you.
Thank you, Sally. Dr. Morse?
Thanks so much, and sorry I had to join a few minutes late.
It's okay.
I know that the topic this morning is specifically around staff, kind of questions and reasonable accommodation. I was just curious if there is a process for patients or kind of what the process is for patients for similar concerns. And if that is a response that should be covered in another meeting or a future meeting, I'm happy to do that. I don't want to take up too much time, but I was just curious about that.
Well, it depends on what the accommodation is for staff members. So Matilda can certainly speak to those accommodations that we provide to staff members who may need language assistance. We also have accommodations that are done through the Office of Patient Relations. So it really depends on what the nature of the accommodation sought is. But just separately, the Office of EEO does not handle complaints of discrimination by staff members who may want to file a complaint. Those complaints normally come to us externally through either the State Division or the City Commission in terms of it's a complaint regarding a denial of a public accommodation, and those matters are handled by the Office of Legal Affairs by me.
Thank you so much. And then how about for patient complaints of discrimination or sexual harassment?
Well, it depends on who the person is complaining of. So everything is dependent on who's complaining, who they're complaining about, and how that is handled. But there is at the system, as you're probably aware, a redress for every type of complaint. They may be in different places, but depending on what it is, there may be coordination between different offices. But if you have a specific question that you would like to get to me offline and I could respond to the board and provide you with that information, I'd be more than happy to do that.
Thanks so much. That sounds great. I'll follow up by email.
Thank you.
Thank you, Dr. Morse. Blanche, I think following Dr. Morse's comments, can you give an example of what you mentioned that it depends, like if a patient complains that either a doctor or a nurse or an administrative assistant did something that made them feel uncomfortable, what would be the different process in that? They will always go external, or do we have like a patient service office or patient's bill of rights or something like that?
Well, of course, we have a patient's bill of rights. Initially, some complaints or grievances come in through patient relations. Some allegations come into us through the IG's offices. Some things could be sent to corporate compliance. Some complaints could be made if it's an affiliate provider. It could be through the affiliate. So it really depends on who makes the complaint and where it originally arises from, and that will determine, and it depends on the nature of the allegation as to who should be responding to it, because if it's criminal conduct, that will be handled separately in a different manner.
So I think we should think about how to best provide this, and it's an interesting question because it shows how different it is. So Blanche's office, because it responds primarily to employees, everybody knows the process. Right. When it comes to patient issues, usually it goes to the facility, right? Because I mean, so in the most both extreme and common would be someone in an inpatient, in a skilled nursing facility, in a psychiatric ward, where there is an allegation of sexual abuse. So in that instance, automatically, the person who is there, if there's any suggestion that somebody committed an act of sexual harassment, that person's removed administratively while we then figure it out. So those things typically happen at the facility. They don't come centrally. And each facility has to have an appropriate process for dealing with this, because it does come up. I mean,
that's
not a
justice-
trivial
yeah.
number.
No, but that's a justice center reporting if it's in.
If it's a mental
psychiatry. Yeah,
health.
so but I think your example was.
Well, I was thinking of a skilled nursing
Oh, I was
facility
thinking,
one.
but in behavioral health, that would
Behavioral
have to
health
go
has
to
its own-
yes, that has to go to the justice center.
So maybe what we need is for the board is a clear explanation, because it is true.
Matters
It matters
where,
the patient is at the time,
correct,
where it goes, but it's always taken seriously.
very,
But it's typically not a corporate central office issue. It's reported where it happens, and the action has to be taken there, and the action always includes removing the person, putting them on admin leave if it's a serious allegation, while we figure it out.
right. And
They
risk will,
report
of course, be involved.
They report to QAPI in many instances, right?
Yeah, I think I will ask for that office, in fact, to do the first round of putting it together, how it would happen, what the process is at each institution.
I think that may be good, because I think the question that Dr. Morse is asking is quite important. And if we can get some information about the processes, each facility may have a little bit different process, and we have a better view of it. And maybe, I don't know how feasible it is to give some statistics similar to what we saw for the internal, if that will be possible. I don't know if Dr. Morse, that would be something of interest to you.
Yeah, thanks so much for taking the question so seriously. I appreciate it. And as a very new proxy for the commissioner, I appreciate you taking the time to get me up to speed, since I'm just a few months into my position here. But yeah, that would be tremendously helpful. And I very much appreciate the reasonable accommodation process. I was kind of more thinking about patient complaints of sexual harassment and racial and ethnic discrimination as the areas of interest. And so yes, if that's possible, that would be very helpful for me.
Dr. Cass, do you think that
Yes, I mean, again, I think to understand, right, how a skilled nursing facility deals with those complaints is different than how a behavioral health unit should deal with it, and it's different than how an outpatient clinic should deal with it. So that's why it's based on the facility. That's both where people will go and what governs that. But it's perfectly right to say, and again, I've definitely seen these complaints, so I know, because sometimes people will copy me on them. So they definitely exist, and we can figure out how Hillary from QAPI, I'll ask her to do a first pass on both sort of how it works at each of the facilities where we see patients, and what numbers we keep.
Thank you, Dr. Cass, and I'm sorry that I got disconnected for some time. The Wi-Fi can be a little bit challenging, and I appreciate that the meeting continue. I have a couple of questions, Blanche, if you don't mind.
Sure.
And I'm following up on Frida's and Sally's comment. Do you think it will be possible that in the next reporting we can get like the average time to close some of those requests, and maybe plot it? I don't know if you will be able to do it for the prior years, because as you said, some of those were not registered timely, but maybe moving forward, looking at the average time, or if you want to do quartiles of of the different closing for the reasonable accommodations. And I believe that depending on the allegations, it may take a little bit longer or shorter. I don't know if they're all follow the same. So that may be helpful. Frida, do you think, and Sally, do you think that will be helpful for you?
Yes.
We're going to do that moving forward. That's one of the
Yes.
adjustments to our gateway, because now it'd be difficult going backwards
Yeah.
to do it. But moving forward, we are going to be doing that. So we could certainly have that for the next report. The only thing that, of course, affects timeliness of investigations is if the person, if either the person being accused is an affiliate staff member, then the investigation is jointly conducted with the affiliate. So we have to schedule together. And if somebody is out on any type of leave, the respondent, the individual being accused, is out on any type of leave, and we wait for them to return before they are interviewed. And every respondent is always interviewed before we close it out. So we have asked people in order to complete the investigations within a certain time frame, and if they're unable to do so, they should make an entry in the gateway letting us know why there was a delay in the completion of the investigation.
And Blanche, would that cover the reasonable accommodation request as well? Because I see there's quite, I think on the prior page maybe, or the earlier page on reasonable accommodations, there's still quite a lot pending from 2018.
Yeah, those are all, again, and that goes on, unfortunately, to the gateway and the information that was actually put in. But normally, the only thing that really delays an accommodation request is scheduling with the department in order to have a conversation regarding the reasonableness of the accommodation request and discussions as to whether or not the accommodation request imposes an undue burden on the department. Because in EEO, you cannot determine whether the accommodation request has any impact on the department. That information comes through a dialogue with the department leadership. So that is part of the process. And I think in 2020, it was the sheer volume that actually affected timeliness. But, again, everybody works to address those right away, especially those individuals who are home and are seeking to return to work, because it's very important to bring our staff back to work. So those are also tried to prioritize those.
Thank you. Frida, Sally, any other questions?
No, thank you.
Okay. The other question that I had, Blanche, is with respect to the reporting. Do we break this per facilities? We were just talking about the patients, the facility. Are there by any chance a facilities or a department that has more requests than others, or that's not kept at that level?
No, we have it at that level. And in fact, the nursing titles were the largest number, was the largest number of individuals seeking reasonable accommodation requests. And the second were the clerical associate title. We do break them down by facility. And in fact, we will be meeting with the CEOs of each facility to go over their numbers with them, the reasonable accommodation requests, the internals and the externals, in order for them to have a better understanding of what's going on in their facility. And in terms of the Office of EEO, when we get complaints, we also look to see what departments they're coming from to understand if there's something going on in the department, because very often people file an EEO as a last resort after they've tried to speak to maybe a supervisor, Dr. Katz, or somebody else, and they feel they haven't received the resolution that they want. They know that EEO has to investigate. So it really becomes an avenue for people to feel that they have a voice. So when these complaints come to us and we look at them, we'll say, oh, it looks like there's a problem in this department, and we will reach out to either our HR partners or to the facility, or we will do a training and actually go in to hear what people have to say, because it's not always about EEO, but it's about something that's bothering them and they feel like they're not being heard, and they're just using EEO as the avenue. But the purpose of all of this is to make sure that every employee feels that they have a voice, and we try to address problems that come to our attention, as does this facility has an interest in that also. We will say to them, maybe the CEO should have a town hall in this department.
Just have one last question. An individual, one of our employees, wait until the external is resolved.
But you can have an external and then his obligation to handle a reasonable accommodation request that you may have. They are totally separate. But we don't investigate an internal and respond to an external at the same time. And that's provided for in our EEO policy. So employees know that.
Okay, thank you. Any other
You're
questions on this topic? I think Dr. Morse, I believe you have certain questions outside of this topic. Is that correct?
I'm not sure specifically. I always have lots of questions, but
I thought I received a comment that you had some question about the algorithm for kidney disease. Is that?
oh, okay. Yeah. Well, thank you for that. I actually did bring it up briefly in the executive meeting as well last week. So I think it was mostly covered at that point. But
Okay.
I did read the meeting minutes from last month for the for this particular committee, the DEI committee. And the main question that I had was just around how the team was thinking about catching up patients who had been harmed by race correction or whose care had been delayed because of race correction, how the team was thinking about closing that gap, I guess. And Dr. Katz mentioned that the nephrology team was going to be thinking a bit more about that. So I think I'm okay. That was okay.
That's good. I think I just had different information, but that's okay. So any other? Any old business? Any new business? Well, I think we are on a record. We're finishing up 20 minutes early. So I guess everybody has found 20 minutes in their day. So thank you, everybody. So with this, the meeting is adjourned. Thank you so much. Bye-bye.
Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
How do you lift up these people? The whole time I was trying to figure it out.
Oh, I have no
Just like
idea.
a
I just sit,
okay.
I just sit where,
High one.
yeah. No, I just sit and I just stay there until it's over. That's how I roll right now.
How are you?
How are you?
I'm doing well, thank
Glad to have
you.
you. Thank you so much.